Gibson here. Today I'm going to be performing the IV maintenance checkoff video. So first I'm going to start with the 12 safety practices. So I'm going to verify the care and order of the client. I'm going to perform hand hygiene before and after performing care or handling any of the equipment. I'm going to verify the facility's policy, and then I'm going to assemble the necessary supplies. I'm going to refer to the manufacturer's guidelines for any of the equipment that I'm going to be using. And then I'm going to knock on the client's door and I'm going to identify them using 2 identifiers. And then I'm going to note the overall condition of the client. I'm going to provide for privacy and explain the procedure. I'm going to elevate the bed to promote good body mechanics. I'm going to don PPE if necessary. And then after I'm finished performing care, I'm going to lower the bed. I'm going to raise the side rails according to the client's care plan. And I'm going to make sure I attach the signal light. And then any abnormalities, I'm going to make sure I report them to the charge nurse. So next we're going to get our flow rate started. So I'm going to start by just assessing to make sure I've got the right solution, making sure that everything is intact, that it's not expired or anything like that. And so our order is for 60 drops per minute. So I'm just going to go ahead and get that started. Now I could do it for 30 seconds and multiply it by 2, but I'm going to go ahead and count for 60 seconds just to get a more accurate reading. So let's go ahead. So we are at 60 drops per minute. Now I'm going to make sure that none of my tubing touches the floor or anything like that, just to make sure it stays clean and intact. So next I'm going to assess the IV puncture site on the client. I'm going to note just their overall condition. I'm going to look for any kind of complications with the IV site. So some of the different complications could be hematoma. And hematoma is infiltration of blood into the tissues at the puncture site. And some of the signs and symptoms could be bruising or swelling or pain. So the interventions for hematoma that you're going to want to do, you're going to want to stop the flow of the IV, and you're going to want to start a new IV on a different extremity on the client, and you're going to want to notify the healthcare provider. So another complication could be infiltration, and that is where the IV catheter gets dislodged or a vein ruptures and IV fluid enters into the subcutaneous tissue around the puncture site. Another complication could be extravasation, and that's when IV fluid contains additives or a vasecant drug that can damage the tissue around the puncture site. So for both infiltration and extravasation, the skin may be taut, it may be blanched, cool to the touch, or painful for the client. So for the interventions, for those you're going to want to stop infusion, and if a vesicant drug has been used, you're going to want to disconnect the IV tubing and aspirate the drug from the catheter. You're going to want to elevate the extremity and contact the healthcare provider, and then you're going to want to apply a warm, moist, or cool compress to the extremity and start a new IV on a different extremity. So another complication could be phlebitis, and that is swelling on the inside of the vein, and it makes the vein become cord-like. There could be, redness or tenderness or pain or warmth along the course of the vein. So for that, you're going to want to stop the infusion. You're going to want to disconnect the IV, and you're going to want to start a new IV on another extremity and apply a warm, moist compress and contact the healthcare provider. So another complication could be, local infection in the extremity. And signs of that could be redness, heat, swelling at the catheter site. And there could even be possible purulent drainage. For that, you're going to want to do a culture if necessary. You're going to want to clean the skin with alcohol, and then you're going to want to remove the catheter, notify the healthcare provider, and start a new IV. And then, if necessary, perform wound care for the IV puncture site. So next, we are going to remove our IV from our patient. So I'm going to put my gloves on. So I'm going to start by putting some tension on the skin, and I'm going to remove the tape, pulling it towards the IV site. And I would discard of that. Now when you're removing the catheter, you want to keep it parallel with the vein. So after you remove it, you're going to want to assess it and make sure that it came out smoothly and that everything is still intact. And after you do that, you're going to want to discard of that in the sharps container. And then immediately after removing that, you're going to want to take some gauze and apply direct pressure for 2 to 3 minutes. And if the client is on an anticoagulant, you're going to want to apply pressure for 5 to 10 minutes. And that concludes the IV maintenance checkup. Thank you.